So, Dr. Rockwell, it's been quite a ride the last 2 years. Our clinics have implemented so many new vaccines, dosing schedules. Um, it's just been overwhelming, I think, for some. And here we are talking about new pneumococcal vaccines and new recommendations. What are some thoughts that you've had as far as how you're going to choose and implement these new ideas?
I couldn't agree more, Sarah. It is very confusing. And I think the CDC does a really good job of trying to make it as simple as possible. But the reality is, we have so many more new vaccines for both children and adults that it's virtually impossible to memorize all the protocols. So I would advise first going to CDC recommendations and guidelines if you're looking for what might best fit in your practice, because there's actually some pros and cons to having PCV 15 and PCV 20 in your practice. And most of us in family medicine already have the PPSV 23 in our practice. And for children, we'll be getting PCV 15 if not already obtained. So I think you just need to think about what might make it best for your patient population and ensuring compliance with following up a two-dose series, for instance. The pros of the PCV 15 is it's really easy to implement into policies that had PCV 13 in the old policies, and then patient gets the PCV 15 and the PPSV 23 a year later. It's age based at 65. It's cost saving, but this also ensures that you know the vaccine history, the timing. It's two separate injections. On the other hand, PCV 20 for folks 65 and older or younger folks who have some immune compromising conditions, it's really easy to just give one shot and be done. So in that way, it may be cost savings if you're a practice that needs to just acquire your new adult pneumococcal vaccines. Um, because it's PCV 20, there are a few extra serotypes included in the coverage, but we really don't have data on immunocompromise for this vaccine. And the PPSV 23 has three different serotypes not in the 20. So it is a pro and con, but the reality is either route that you go or choose is good for your patients.
Absolutely. I would agree with that. And I think one thing that we've decided as a clinic is we have to think about our patient population. We're in a rural practice. And so getting folks back to the clinic for a second vaccine has been difficult with the old recommendations. And so for our clinic and also looking at the cost whenever these vaccines go unused or they expire, when you're having two versus one, that makes a difference to consider. And I think one of the things we've really been introducing to our standing orders and when our nurses room our patients is just a strong use of language or using language such as today we're going to do this vaccine, today it's time for this vaccination. Those kinds of things really help as opposed to do you want to get your pneumococcal vaccine? So the strong language will really help with this once you decide which route to choose for your clinic and your patient population. The standing orders are fantastic. It's great to get the nurses involved. So when the patients come in, they can go ahead and have that done before you get into the room. I also think holding vaccine clinics are a great idea. And I think if any of you have organized anything like that, you know you put a lot of work into it. There's balloons and fanfare, and you may not get a quarter of the folks you would hope to take care of that day. However, the benefit is people have driven by, they've seen the signs, they've seen the advertisements, and you will get people trickle into your regular clinic. Oh, you know what? I saw that, but I didn't have time that day. So they are important, and that work, even though at the time it feels unnoticed, it is noticed and it is effective. And I think combining these vaccines is really important too. We know the language of the CDC changed with the COVID vaccines. You can now combine these vaccines. They're not live vaccinations. They can be given the same day or really at any interval, and that makes things easier too. You can update vaccines all at the same time, which is great.
I agree completely. There's really good evidence now showing that using a presumptive approach when vaccination recommendations are made, like I highly recommend you get X vaccine, is one of the highest indicator of patients accepting the vaccine. So that involves training of your staff, standing orders, like previously mentioned, but also maybe use your electronic health records so that um, it shows if somebody already received PCV 15, maybe not even at your practice, but through the state registry, then the next step would be to give PPSV 23. So there isn't an error there. Or if you want to just cut out all that potential, just stock your PCV 20 for your adults.